What is compartment syndrome?
It's a condition caused by increased pressure within a confined body space, especially one of the leg or the forearm.
What happens in compartment syndrome is groups of organs of muscles are organized into areas called compartment strong webs of connective tissue called fascia from the walls of these compartments. After an injury, blood or edema, fluid resulting from inflammation or injury may accumulate in the compartment. The tough walls of fascia cannot easily expand, and compartment pressure rises, preventing adequate blood flow to tissues inside the compartment severe. And tissue damage can result with loss of body function or even death.
Hurts when I run. That's what many orthopedic surgeons hear when runners and other athletes come into their offices. Sometimes people have obvious problems such as strains or sprains. Other times these issues can be tricky to diagnose. The runner you're about to meet had symptoms he thought were no big deal, but he ended up having a condition that required an operation. More on compartment syndrome from Mayo Clinic.
A lot of cramping kind of in the front part of my shins.
30-year-old Rudy Kovakovic first noticed those symptoms when he was running track and cross country back in high school. He thought maybe it was shin splints.
My symptoms kind of progressed from there. It would get to the point where the muscles were so tight in the front that I'd have a hard time actually lifting my foot up when I was running. And I would eventually usually have to stop in the middle of races.
Rudy had what's called compartment syndrome.
Compartments are basically groups of muscles that are together inside all of our body parts, and they're surrounded by a fascial or a layer of, like I say, sort of like skin.
Orthopedic surgeon Dr. Amy McIntosh says that layer acts like a rubber band, which usually expands when you use your muscles, like when you run. But sometimes it's too tight. It doesn't expand. Pressures rise and can constrict nerves and blood supply, which causes pain and tightness.
And the only way to increase the volume to decrease the pressure is to make a cut in that fascial layer.
This is the actual incision here.
Compartment syndrome does not have a lot of ways in which you can be able to identify the thing at home, like running little tests that hurt in a certain type of place in your body where you can say, oh, this is compartment syndrome and I know for sure that this works. There is one thing you can use which is called the 5 Ps, but it will not be 100% accurate for the fact that the only way you can find out if you have compartment syndrome or not is to go to a doctor and get diagnosed and to seek professional help. Continuing on to the 5 Ps, the first P is pain. And pain is different from other pain. However, you can't just feel a certain, pain in general and say, oh, this is compartment syndrome. Because if you fracture a bone, you feel pain. If you run into a wall, you feel pain. If you're texting and your phone falls on your face, you feel pain. This pain is distinguished from post-operative pain and others such as that, which has, of course, like there is a different levels of pain, just like needles, you feel like something stabbing you, you feel a burning and aching sensation. So this is distinguished from other types of pain. Another note for this to, elaborate a little bit more on the pain. It will be progressive and it will be diffuse, which means it's spread a lot and it's spread fast. Just like the lettuce incident that happened a while ago, right here, 2018, pretty much in November, and people were scared to eat lettuce because of the whole E. coli thing and how it was pretty much nationwide. Pretend this is lettuce, because I don't have any. So. Continuing on to the 5 Ps of compartment syndrome, after one of the main ones, which is pain, which again I have described is often frequent in whenever you hurt yourself and you will feel after an injury, but it has a distinction like others from post-operative pain and just can be identified differently than just a flick or, bumping into a wall as I had described earlier. Pallor is the second one, and it is described as when the certain spot of where your injury could be and where it is swelling up and such is ashy or it is white. And I will bring out an example of what color it can look like in just a second. If your injury starts to look like this, white dog, it's either one of two things. You're either privileged or you may have compartment syndrome. Okay, so we've discussed pain and we've discussed pallor. And of course, as I described, pain has a distinct sensation, while pallor is a distinct color of whiteness or ashiness. The next one we will be discussing is paresthesia. And what is paresthesia, you might ask? Paresthesia is when doctors can try to test to see how much sensation you have in your leg. If you have a slightly like your leg is falling asleep or very light sensation, and in worst cases where you don't feel any sensation at all, that is a symptom of compartment syndrome. However, you may not feel things like this. Continuing on to that, a lot of doctors test with the pen cap, trying to touch between your toes, between the spot and where the compartment syndrome may be. And using this test, depending if you feel no feeling or as if the part where they're touching you with the pen cap is asleep, you may or may not have compartment syndrome. Using, of course, pain, pallor, and paresthesia to be able to test this out as well.
We discussed pain, pallor, and paresthesia. Remember that they don't have to be conducted in this order because they just can help identify it as possible injury. The next is paralysis. Paralysis. If the nerve is distal to the extremely injured or pressed upon the impending compartment syndrome, the patient will not be able to move the toes and fingers, just like this. Inability to dorsiflex and plantar flex their toes should be noted as well as any weakness experienced. These movements may cause the patient pain, but the purpose of the assessment is to find if the patient will retains movement and the extremely similarity. Arm injuries would require it would require flexion and extension of the wrist and fingers. Chronic is something that happens over time. It does not happen then and there. If you have any chronic pain, you should let your doctor. You should notify your doctor.
Next one, we will be discussing in the 5 P's, which we have already discussed: pain, pallor, paresthesia, paralysis, and now we will be discussing pulse. Pulse, of course, is determined between the blood flow that your heart is going to distribute around your body. But if you have a compartment syndrome, you may not be able to feel the pulse go through your body in the certain spot and where you think compartment syndrome is. So it won't have any blood flow, therefore is the reason why it turns pallor, which we had discussed in the next video, and where you feel pain, because there will be a lot of swelling. And the only way you will be able to stop the swelling is if you cut open and you make 2 cuts, which we will show you in a video in a couple of seconds.
Here, this is easy enough to do. What some people will do is they'll make a little cross and they'll make a little thing like that. But for me, I'm right over his fibular compartment. Okay, here's his fibula, so. Got a good shot at that, Carlo? Yep. Right there. And down here, come just underneath there, John. You want to run this? Scissor open. Okay. Okay. Push it down. Just shove it. Nope. Right towards the fibula head. Right here. Stop right here. Good. Perfect. Good. Nice. Done with the lateral. Okay.